Hi, everybody. Good afternoon. My name is Melissa Gerson. I'm a therapist and the clinical director of Columbus Park, which is an outpatient eating disorder treatment center in New York City, and also the director of My Three Square, which is the platform we're using now for our Meet and Eat Together series. Today, I have a very special guest, a colleague of mine. Her name is Elisabeth Byrnes, and she's going to be talking a bunch today about DBT, which is a very particular kind of treatment that many people have probably heard about. If you haven't heard about it, I think you'll find this episode of our series really interesting. Liz actually is also a colleague of mine. So she's one of our virtual therapists at Columbus Park. And she also is working currently in San Diego, where she lives now, for a very well-respected DBT program there. Mm-hmm. So before I turn things over to Liz, we are going to begin with just a quick check-in around the meal that we're all bringing to this meeting today. And so I'm going to just start with mine. Our general guideline for meal support, whether it's on this platform or in our center, when our patients bring meals to one of our groups, we ask that the meal is balanced. We try to work on variety so that if possible, we work to a place where each time you're trying something a little bit different, maybe exposing yourself to some things that are a little bit scarier for you over time. But we ask also, in order to keep some balance, our rough guideline is that the meal ideally would have protein, carbohydrate, adequate fat, and then on the side, you could have fruit, vegetable. We tend to be a little bit more flexible with the fruits and vegetables because it does seem that most of our patients are more comfortable with fruit and vegetables, but maybe have a little bit of a harder time with some of the other components. So my meal today, I'm gonna angle my laptop so you can see. This is one of my specialties. It's a bolognese sauce. So it has ground beef with some mixed vegetables in a marinara, which, trust me, I don't make by myself. It's just, I use Rayo's. I like that marinara sauce. So I use a jarred marinara, but everyone always loves it. It's really tasty. And then I brought a salad as well, just to flesh out my meal. What we think about with salads, my salad actually just has greens and red pepper and some Parmesan cheese and regular dressing. It's like a balsamic vinaigrette. And usually our guidance for people around salad dressings, we really try to encourage a regular salad dressing as opposed to a non-fat or low-fat. In our center, we just really try to get people more comfortable with adding fat to a salad. And we also advise, when dressing your salad, to just not measure your salad dressing, but instead really just try to be sure that all of the leaves are covered with dressing, that there's a little bit of dressing on every leaf. And so in terms of how I thought about my meal today, it was based on what I had. This is some leftover food from last night's dinner. I liked the meal, so I kind of wanted more last night. So it sort of stayed with me today, and I was looking forward to it. It's also kind of a comforting meal, pasta with meat sauce. It's sort of like a little bit heavier and just very comforting. Given the COVID crisis, I think we all can use a little bit more comfort from our food. And in terms of the portioning, what I've developed over time is that skill of being able to eyeball a portion for myself. So I don't measure, I don't weigh my food, but I can, after meal and meal and meal again and again, eating adequate portions, you begin to learn what your meal needs to look like, and you don't feel as reliant on measuring your food. So I just knew, what it looks like when I eat a bowl of pasta with meat sauce, and that's how I did my portioning. Liz, do you want to share your meal component?
Yeah. So we had very similar ideas. They were going Italian today. I actually have with me lasagna. So I made a really big, I'm not sure if you can see, a really big batch of lasagna that I've just been eating like every single night. I even froze some. I made a huge batch. So I have my lasagna that the sauce is tomatoes. There's onions in there. We have a lot of ricotta cheese and mozzarella cheese on top, which is my favorite. I've got a roll on the side and some broccoli that I just roasted really quickly with just a little bit of olive oil and salt and pepper on top. So again, I think I had the same idea as you, Melissa. I wanted something that was just like really easy and accessible because, we're trying to limit our exposure going to the grocery store. So I've been just making things in bulk that I think that actually tastes really well as the days go on. In fact, for some reason, my lasagna tastes better as leftovers than the day of. So that was kind of my intention there and my thought. And also I wanted to eat something knowing that I was going to be talking to people about DBT today, something that I can just eat with a fork and chew. I wanted to be mindful of my pacing today, knowing that I was going to be balancing eating and talking at the same time.
Yeah.
So that's kind of where my mind was. It was being efficient and trying to be mindful of, my responsibilities today. So
Great.
right,
And
yeah.
on that topic, for our listeners, probably while we're talking at the start during the meal portion, which is about a half an hour, we give to the actual meal portion of these meetings. I'm going to probably be setting the pace for the most part. I'm going to be eating continuously because Liz, I think you're going to be doing a lot more of the talking.
Right.
So our viewers, if you're working on pacing, whether you're trying to speed up your pacing or slow down your pacing, I'm going to try to stay pretty steady with my pacing. So you can kind of look to my mouthfuls as a guide if that's something that you're working on. And Liz, you don't have to feel too much pressure if you're talking a lot. If you do more of your eating kind of toward the end, that's okay too. We're not going to worry too much about it. I want you to be comfortable.
Yeah.
The other thing that we do after we check in about the components is we set an intention. And if you've listened to the series before, you may already know this, but what we like to do is kind of go into the meal thoughtfully and really thinking about what it is that we want to be working on today. And oftentimes we'll hear people say, I'm challenging myself with a meal today, so I want to get through it. Or I'm working on decreasing my negative thoughts and judgments during the meal. And to do that, I'm going to really keep kind of turning my mind back to the distraction of the conversation. Some people will want to work on a very particular skill they might have learned in their therapy to support their own thinking and emotions during a meal. Liz, you've done so many meals at our center.
Yeah.
You think of some intentions that people would set that I haven't listed yet that people might want to think about?
Yeah, absolutely. So some really common intentions we see for those suffering or those trying to weight restore, completion is a really big one. Like their intention
Yeah.
is like I'm going to complete. Another people, their intention is trying to be able to socialize while they're eating. So when they notice their mind really becoming internally preoccupied on the food, acting opposite and deciding to engage in a conversation or reach out to somebody and talk. So intentions around increasing socialization during mealtime can be great. Some other intentions we often see is self-compassion and self-validation. Seeing through the meal if negative mood states come up, whether you want to intentionally work on distracting yourself or very quickly maybe checking the facts on that emotion that's popping up. And I'm definitely going to be talking a little bit more about how to check the facts when I begin my portion. But I think self-validation and self-compassion are really great intentions to have too, especially if eating the food is so challenging or getting the food down is challenging.
I really like those. Thank you.
Yeah.
And I hope that let's try to make sure we teach the opposite action skill today. And what was the other one that you said? Oh, checking the facts. Let's try to cover those today. So I'm going to set a timer for 15 minutes. That's halfway through our meal portion. And I'm just going to set that so people can kind of be aware of their timing. And so it'll go off and then we'll just keep talking. And then I'll also set another timer to let us know when we have 5 minutes left of the meal. And then I'll let you know when we're finished with the meal portion. So,
that's helpful.
So I guess, Liz, let's just kind of jump in. First, dialectical behavior therapy. It's a treatment that was designed to treat a number of different conditions, and its use has been expanded now beyond its kind of original intention. Can you first just share with us more generally, what is dialectical behavior therapy?
Sure. It's so interesting. Whenever I talk to people about DBT, I find myself often saying like, oh, it's a newer kind of therapy. And I recently realized, it's not so new anymore.
Not so new.
It was created by a woman named Marsha Linehan in the 1970s for people specifically suffering from borderline personality disorder. But really, since then, we have robust evidence, and we've had so much research that shows that DBT is actually really effective for any treatment that has severe chronic behavioral issues, that including eating disorders. Specifically. So yes, it is the ideal gold standard treatment for people suffering from borderline personality disorder, but we often see it with eating disorders, substance abuse, just anything, treatment-resistant depression, things that people just have been suffering from chronically for several years. So yeah, it's not so new anymore. We've got like so much research. I feel like a lot more people know about it now. It's really fabulous. It's wonderful. But I think the biggest thing that I just want to start with is explaining the D in DBT. I think a lot of people never really heard of the word dialectic until DBT became a more well-known treatment. So DBT, the D in DBT stands for dialectic, B is behavior, and T is therapy. So really a dialectic is when somebody has two opposing truths in their life. And this can look like, this can be as extreme as wanting to die and wanting to live at the same time, right? Those are two opposing truths that are both true for the person. Or even with eating disorders, it can be so difficult. Like, I want to get better and don't want to give up behaviors that do make me feel better. So I think that that ambivalence that we often see is really common. And the brain doesn't really like when two things are opposing. But we know in DBT that two opposing truths can exist at the same time. So a lot of the DBT treatment is going to be synthesizing those opposites for us, or those dialectics. So the main dialect we see in DBT is acceptance and change. So we're asking clients to accept themselves for who they are and change, because the way that they are operating in the world today maybe is resulting in some dysfunctional maladaptive behavior. And again, I think that can be really challenging, but I think the reason why it's so effective for chronic issues is when Marsha Linehan was using really only validation in treatment, or using a person-centered approach, a lot of clients would be like, so yeah, Marsha, like, you understand me, but aren't you going to help me get better? And then when she was too change-oriented, doing really a CBT-focused therapy, the clients would say, like, you're asking too much of me. You must not understand my pain. So that's why she created DBT. It was this really great synthesis of understanding the person's pain, understanding and accepting where they're at, and needing to change. So if I had to kind of explain DBT in one sentence, it would be, you're doing the best you can today, and tomorrow you got to do a little better. So again, it's kind of this really sweet, compassionate, yet tough approach that I think lands really well for a lot of people.
Yeah, and I think what we notice, it's interesting as a DBT provider, because oftentimes you'll find yourself saying to yourself, I think I'm falling a little too much on the change side right now, and I need to go back to validation because I'm getting some, I feel we're a little stuck, or things aren't working at the moment. Or you might say, I've been really good with the validation piece, but the change piece, I think, is where we really need to go right now. So it's a really helpful way for clinicians to be able to think about the treatment and reflect on what's working and what's not working and why.
Exactly. And that's what I love about DBT so much, is we really understand that things in this life are transactional. We interact with our environment, but our environment also interacts with us, right? And they are transactions. So we really see in DBT that the clinician is really seen not as somebody with power in the relationship. It's extremely collaborative. So the therapist is able, there's space in the treatment for the therapist to see how they might be engaging in behaviors that are maybe keeping the client stuck. So I think that that's absolutely right. Being able to talk to other DBT clinicians and know if you've been maybe validating too much, or if you have been a little bit too hard on your client and asking them to change too much. And us owning that we have our own therapist interfering behaviors sometimes.
Yeah, I want to talk more about therapy interfering behaviors. First, I wonder if you could break it out for us. What does DBT look like? What is the structure of DBT, and what do those sessions look like?
Sure. So DBT is a little bit different than other therapies. It is considered a cognitive behavioral therapy. It's a third generation. It's kind of like CBT's cousin, I like to say. But DBT is different for two reasons. One is the theory upon which our therapy rests, and that's called the biosocial theory. And then the second is the protocol that we follow that other therapies don't have. So the protocol or an adherent DBT program would look like a client being an individual therapy one time a week, where they're with a DBT clinician. In addition to being in therapy one time a week, they are also attending a DBT skills group for an hour and a half one time a week. And again, the DBT skills group is really, it operates very similar to a classroom. You have two facilitators that are usually using a whiteboard and just going over one skill that they want you to learn that day. It's a chance to practice mindfulness activities, to review homework that was assigned in the last session. And then 45 minutes of it is really just a didactic where the therapists are teaching the group. So in addition to the group therapy and the individual, they also have 24-hour phone coaching. So this is what's so, I think, great about DBT is that we believe that behaviors have to be learned in all contexts. And we want people to be able to use skills when they're in the middle of a crisis or when they're in the middle of trying to make something different happen. So they have the opportunity to call their therapist 24 hours a day and get coaching in real time. And if you are in DBT therapy, your therapist will go over more specifically with you what phone coaching entails, but it really is helpful with that goal acquisition or that skill generalization, which is great. And then lastly, the fourth component that's part of the protocol is more for the therapist, and that is them being a part of a DBT consultation group. We just believe that more heads are better than one. So one time a week, if I'm committing to my clients that I'll go to a group one time a week to make sure that they're getting the best treatment possible. And I'm being up to date on the newest research. And really, it's almost therapy for the therapist too, because we are dealing with people who have very chronic, serious issues, especially with AN. We know that it can a lot of mental health complications. So if I'm working with somebody and their life is in danger, I want to make sure I have a team of people and that person is getting like the ultimate care. As DBT was originally designed for people with suicidal ideation, it was important, given the clients did have high risk behaviors, that the therapist had a team to fall back on. So that's kind of what makes DBT.
Yeah, so that's the structure. And so I want to just mention one thing. You know, a lot of people talk about DBT, and sometimes we'll have people who come to our treatment and say, I've done DBT before, but I think that Linehan's group and people who are very serious about practicing DBT really like to differentiate between what we might call DBT light, which is a much more relaxed version of DBT, where there might be some teaching of skills, some reference to the protocol, but not at all delivering the treatment as intended. Then there's something called comprehensive DBT, which a lot of practices practice very, very well, which is that it's almost adherent. So many of the requirements of a real DBT protocol are met. However, there might be certain elements that are not quite there. Like, so for example, in our center at Columbus Park, we refer to our DBT as comprehensive because we have all the four components, but our treatment groups are not facilitated by two providers. Our treatment groups are small and they're facilitated by one provider. So just because we have something like that is not actually true to the model, we refer to our DBT as comprehensive. Now, Liz, I know you're also working right now in a real adherent DBT practice, working with children and adolescents, and the DBT that you're offering there is completely by the book. You have all four components: individual, group skills, coaching, DBT team for the provider, and you are delivering it exactly as intended by the Linehan model. So,
yeah, but yeah. And I mean, I do think though, any DBT is better than no DBT. I mean, I've really seen DBT work miracles. So like, I think, yeah, it really just depends on, I think facilities, barriers, their limits to different things. So, you know, especially with the phone coaching, the adherent model says that the provider should should allow 24-hour phone coaching, but not every therapist is able to do that given circumstances they have. So of course, and even I'm in a very adherent center, but life happens. I mean, I'll have a colleague come down with the flu, so I'll be running a group, solo every once in a while. We just try really hard to live up to those ideal expectations. But yeah, I think comprehensive DBT though is just as, like I said, any DBT is better than no DBT. I really think that.
Absolutely.
Yeah. Mm-hmm.
Now, what we do is DBT with an adaptation for eating disorders. So we took the very kind of the DBT model and we added some shifts. We didn't do it, but it's over time, very smart people working within DBT have figured out how to get the best of DBT, but to model it after the needs of people who struggle with eating disorders. So can you speak a little bit about some of those adaptations?
Yeah, totally. So, I mean, I think there's a few things. I guess for the sake of our meet and eat today, I'll probably just kind of refer to the 3 eating disorders that people are mostly familiar with, which is anorexia, bulimia, and binge eating. There's definitely more kinds, and not everybody falls into a perfect category. But just for today's conversation, I'll just kind of stick to those 3 more well-known ones. And DBT, we have a lot of research that shows that DBT is particularly effective for bulimia and binge eating disorder. We often see that bulimia and binge eating disorder, it operates under the expectation that eating is a primary means to alleviate negative distress. So if somebody is starting to become aware of a negative emotion happening, they want to escape that feeling, typically using food maladaptively. So we have a lot of evidence that shows that if a person can learn how to regulate their emotions more effectively, they'll be able to respond better to food cravings or those urges to overeat or eat compulsively. Now, as far as, so we have really amazing research that really supports DBT being an effective approach for the eating disorders that tend to fall on what more we consider an under control or a skills deficit in regulating emotions. On the other side, we have anorexia, which is more seen as being overly in control of tolerating distress or their emotional experience. And unfortunately, I think as a field, we don't have as much research as we wish we had for evidence-based treatments for anorexia. Mm-hmm. But we can make the case that DBT can be really effective for anorexia, or AN as it's kind of sometimes referred to, because DBT, going back to what we were talking about before, therapy interfering behaviors, one really common therapy interfering behavior we see with anorexia is dropping out, because it's such a difficult, aggressive disorder to treat, and people are so ambivalent about it because it can be so hard if they've been restricting for so long. Just the idea of needing to weight restore can be extremely challenging. But the fact that we have a protocol in place to have those difficult conversations about wanting to drop out, I think is really helpful in having the client stay in. So again, I think that that's just one huge barrier we see to treating anorexia, and DBT has language for that, which I think is really helpful. And I think a lot of people can relate to wanting to get better and not at the same time, because they have such an intense fear of what it would mean to weight restore. So, and also with anorexia, we often see extreme fearful avoidance of food. And DBT really helps us target fearful events or how to regulate our emotions with fear that comes up that may be unjustified, totally valid, but maybe a little unjustified, how we can respond to that better. So I just think in general, the protocol and some of the skills that we have can really make a great case for treating anorexia. And at the same time, we have a ton of evidence that bulimia and binge eating is really great. So
that's our 15-minute timer. And I just want to say one thing, just sort of quickly. I think a lot of people who struggle with emotional eating or binge eating can definitely identify that those behaviors happen often around certain emotions. So boredom is one emotion that we often hear can be associated with more urges to eat or to overeat. Loneliness is a big one. Sadness. Sometimes we'll hear people say that even joy and, you know, many positive feelings can feel associated with wanting to reward as well. But I think the DBT protocol is super helpful when the eating behavior serves an emotion regulation function. So when you use food to make yourself, to soothe yourself, or to make yourself feel better in the moment, it's serving you. It's serving you in a really important way. It's serving a function of decreasing whatever negative affect you have. And so with DBT, we're not just saying stop doing that. We're saying do this instead. When you feel bored, or when you feel depressed or lonely, or whatever the feeling is, you know, these are some strategies that you can use in the moment so that you're less reliant on the food to help you.
Absolutely, because you know, there's nothing wrong with mindful eating. I mean, people mindfully eat all the time. I mean, how many times do you see a TV show where somebody's going through a breakup and a best friend comes over with some ice cream and they're eating out? Like, I think that that's a very normal
Yeah.
thing. It just becomes problematic when that's the only skill we have to regulate a negative emotion. So it's more again, it's this like dialect of us knowing mindful eating it does soothe people. A lot of people will say like drinking tea can be soothing. So just again, like balancing when it's effective and when it's effective and when it becomes maladaptive, because people oftentimes overeating, the reason why the person keeps doing it despite knowing it makes them feel so crummy inside is because it works, right?
Mm-hmm.
It's just in the long term it ends up just creating a lot of issues, exacerbating a lot of feelings of powerlessness and helplessness. So the long term, the short term it's effective, long term not so much.
Yeah, people will say there's nothing that makes me feel better in the same way, but
And I believe
oftentimes
that.
that's the short term
Yeah.
soothing, but in the bigger picture, it becomes damaging, and it wears away at your self-esteem.
And I believe my clients when they say eating's the only thing that makes me feel better. I really believe them, because it's almost like the person has built mastery in using that maladaptive coping skill for so long, and for so many years that has been what you're doing. Your brain has learned that that is what works. So again, I think DBT is not asking you to try harder, but try different, something different, make something different happen. I feel like it could be helpful for me to go through each of the modules
That would be great.
and just give a little bit of just like maybe a little skill here and there that people can use. So what I'm saying before is we have the acceptance strategies that somebody will learn, and the change strategies that somebody will learn. And we're constantly looking on synthesizing those two things. So there's 2 modules that fall under each. So there's a total of 4 modules in the adult program. So I'll start with the acceptance side, or the acceptance strategies. And one of the modules that falls on the acceptance side is called the distress tolerance module. So in this module, the idea is for our clients to learn a much wider range of coping mechanisms, particularly the ability to self-soothe and self-nurture, I mean. So I think a lot of people, the only way that they know how currently to self-soothe is by overeating, or filling themselves up in that way. So
Or starving, or not eating, you know, right? Like sometimes not eating actually, for some people, just based on their own brain chemistry, the not eating actually can produce kind of a soothing response.
Absolutely. I mean, most people when they're anxious say, I can't eat when I'm anxious. So absolutely, the absence of food can help regulate anxiety for sure. So the more somebody practices distress tolerance skills over and over, I like to think of distress tolerance skills, the more you use them, it's kind of like a water in a bucket approach. Like the first time you use it, you'll white knuckle, like either white knuckling your way through a meal or white knuckling your way to avoid a food craving. But over time, you will build mastery. You will be able to use the distress tolerance skills much more regularly to help tolerate distress in your life. So we use distress tolerance when we're just trying to not make a situation worse, right? Like that's what we kind of know is we know, or my people who suffer from binge eating will often say, I know like my day was horrible, but if I binge, I know my day will be a lot worse. So distress tolerance skills can be really helpful in having a person resist the urge to engage in binge eating. So I would say like one skill that I would often say if you are suffering from binge eating is distraction or finding new ways to self-soothe, knowing that at first they might not feel that great. But distress tolerance says if you don't binge, it was successful. It almost doesn't matter. Like it's not really looking so much at like this skill making you feel a whole lot better. This is just achieving goals. So if you are able to use distress tolerance to complete your meal, because that's on your meal plan, awesome. So some distress tolerance can be progressive muscle relaxation. So even right now, if somebody's having trouble really getting through these last 15 minutes eating, I want to encourage you to squeeze your hands and let go. Squeeze your hands and let go underneath the table. This is a skill that can help relax yourself and can just really help calm yourself down so that you can finish eating the meal. What I love about that skill is you can be in public and do it and nobody will know. Like right now, I'm squeezing my fists and letting go and really nobody knows I'm being skillful right now. On the other side, if you are somebody who is you're having the opposite problem, you're trying to not eat, if you notice yourself having food cravings and you know you ate adequately that day, so your goal is to resist that urge to eat, distract yourself. Go outside, get your hands wet, maybe garden or do dishes even. Just do something incompatible with eating. Again, like it might not feel all that great because you might continue to think about the food, but as long as your hands are wet, like you won't be able to eat. And again, the whole idea here is if you in the first example, if you finished your meal, amazing, you did it. Right? You might not feel great about it, but you met your goal.
But then you also build mastery and a feeling of an experience of confidence in yourself. With each and every success like that, they build on one another.
Yeah. So it depends on where you're at in your treatment. But I would say that those are really great strategies for distress tolerance when you're just trying to not make.
Oh, sorry, I'm just going to interrupt. We have about 5 more minutes left of the eating portion, but don't worry, Liz, you don't have to eat and talk the whole time. You can do the best you can.
Like halfway done here. So
Good job.
So yeah, so I think there's just stress tolerance when you just don't want to make your situation worse. For some people, their situation being worse is not eating. For other people, it's overeating. So figuring out what's right for you and using the distress tolerance to support that. The second module that we see on the acceptance side is mindfulness strategies. Excuse me. So with mindfulness, we're learning how to have intentional awareness. So you learning how to be in control of your attention. So what that means is you get to decide what you pay attention to for how long you pay attention to it for, and really being able to increase that emotional awareness. So with eating disorders, the mindfulness skills are taught to counteract our tendency to use binge eating to avoid negative mood states. So I think so often people with bulimia or binge eating, when they start sensing a negative emotion coming up, the thought is like, I need to escape. I need to avoid this at all costs, whether that's engaging in an old coping behavior, whether it is overeating. But this idea is like, as a negative emotion is coming, being able to just escape it at all costs. So DBT is actually going to say the opposite to you. It's going to say lean in and be mindful of that negative emotional experience that's happening instead of just wanting to escape it right away. So it's learning how to be non-judgmental about our emotional experience and then actually sustaining attention of the negative emotion while it is coming up for you. A few things happen with this. One is when you expose yourself to a negative emotion that you've been avoiding for so long, you're teaching yourself that maybe experiencing the emotion isn't as catastrophic as we once thought it was. For so long, we just have gotten into the habit of wanting to avoid that emotional state, whether it's feeling anxious so we don't want to eat, or feeling anxious so we do want to eat, right? Everybody's like so different with these things. But it's just us becoming very mindful of the negative emotion without trying to change it, without attachment to it, and just being really curious about it. What I love about mindfulness over time is it really shows you that you're the boss of your emotions, right? You can have emotions and they don't necessarily have to govern your behaviors. They just can be a part of you. Mindfulness in particular, I think, is really helpful with my clients who often describe having this out-of-body experience when they are eating when they are eating a lot of food. So if you are somebody who feels like you kind of have that out of body experience, either when you're eating, overeating, or when you're just eating because it's a part of your meal plan to complete the meal, and you find that you are maybe dissociating or just kind of like leaving the room, mindfulness helps us come back to the present moment and us stay where we are. So we will often say with mindfulness is just do one thing at a time. So when you're walking, just walk. When you're eating, just eat. So this can be helpful for certain people or not helpful, where if you are trying to use some mindfulness strategies, try to taste the food, right? We might maybe people who are having trouble eating, they don't want to think about the meal at all. They're just trying to eat to be in accordance with their treatment plan. But mindfulness says like really just be mindful of the meal so that you can kind of rewire your brain and teach your brain that the meal isn't a feared event. It's not something to be avoided. And then you'll build mastery over time with that. So those are the two modules that fall on the acceptance side, is using mindfulness skills to help you become more aware of your negative emotions and learn that you don't need to run from them. And then distress tolerance is just not making the situation worse. So
just one quick thing, as you're speaking, what's coming to mind is one of the really amazing things about DBT is that you learn so many skills. I mean, there are dozens of skills. And the idea is that not every skill is going to work for every person, but you can pick and choose. You can, as you're learning, you're going to get a whole toolbox and you can choose which of the skills are most helpful for you. And that's the work you also do with your therapist one-on-one. You know, your therapist begins to know you and know how you work and can begin to target these skills specifically to your needs.
Absolutely.
And so some skills might just seem, this is dumb, this is not going to work for me. No problem. You don't have to be jazzed by every single one.
Mm-hmm, mm-hmm. In fact, it takes 6 months to learn each skill. That's how many skills there are. It takes a full 6 months in a skills training group to learn each skill one time. We often suggest people learn them each 2 times, and it takes about a year, because the first time we learn them, we can be overwhelmed, or we can be really, maybe even in our eating disorder, the volume of our eating disorder can be so high, it can maybe interrupt with the learning experience that we're having. So really, there's so many skills. Absolutely.
One thing I just want to say about that, and a nice thing about DBT, is that this is not intended to be forever. You're not in treatment forever in DBT. I mean, it's really designed to be, you learn all of the skills over the course of a 6-month period, and then it's advisable to repeat it. So as you enter into DBT, you're really thinking about this as a 1-year commitment. But you're not going to be involved in a protracted experience of a therapy that's sort of unending.
Yeah, absolutely. So I guess let me go to the change side of the dialectic. And these are skills. This is the part of the dialectic I was saying before, is like you have to do better tomorrow. So you're doing the best you can, use distress tolerance, mindful. You got to do a little bit better tomorrow, or not engage in those old copings, not leaning back on restriction or overeating or whatever your symptom may be. This is where we want you to do skills to actually make something different happen. And the 2 modules on this side are emotion regulation and interpersonal effectiveness. So let me go into emotion regulation, because this is really our ability to control or influence which emotions we have, when we have them, how you experience them, and how you express them. So it's really you learning how to be in control of your emotions. I often like to think of this module as a way your DBT therapist can help you recalibrate maybe your emotional thermostat that has gotten a little bit maybe wonky over the years because of messages received. I mean, we think about the diet industry. It's a multi-million-dollar invalidating environment that is constantly talking to our clients and really just undoing all those messages we receive that are invalidating, can really cause us to feel emotions that are painful and valid, but not necessarily justified. So our emotion regulation skills are really going to help us learn how to assess the function of our emotions, and based on that assessment, decide what to do. So I think a lot of people with eating disorders, when they are experiencing a painful emotion, they'll usually express to me an urgency to problem solve, just to either get rid of it right away, or to get rid of the emotion, or to just problem solve the situation. Maybe like, I think I often see, what I love about working with patients with eating disorders is we usually see these amazing traits, like very driven, they're action oriented. So these amazing traits, the eating disorder is kind of using for evil and not for good. So I just want to point that out too, that so we kind of just need to reset, I think, the emotional thermostat, where some of these traits have been now colluding with our disorder instead of helping us in our recovery. So I think that the biggest thing here is understanding the function of emotions. So we know emotions have three purposes. They communicate to us, they motivate us, and they communicate to others that something is going on. One emotion that I'll often hear people with eating disorders say is how much fear, guilt, or shame they have around eating. So let me give you an example, a little bit of what I mean by assessing the function of an emotion and whether or not problem solving actually is the answer, because sometimes problem solving is absolutely something that it would be effective to do, but other times us problem solving when there's nothing to problem solve can make us feel worse. So for instance, let's look at the emotion of shame. So shame, from an evolutionary perspective, tells us that we need to be a part of a group, right? We're social beings, we're social people, and we thrive in group environments. And shame tells us, it communicates to us, we have something about us that if people found it out, they would reject us from the community. So shame is really important because it really helps us with our being mindfully relational and just kind of understanding that we are on planet Earth and people will reject us. And if we know that they will, like, don't share like a secret about you that's having. Now, I think a lot of the times with food, people are having this emotion and it's not necessarily justified, right? So I often give the example with guilt is getting my nails done, right? I often feel guilty when I'm getting a pedicure just because I like feel so bad that somebody is like working on my feet, and I often feel guilty about that. But when I think about it, I'm feeling that guilt internally, but asking myself, is my behavior violating a moral code right now? I'm like, no, not at all. I like actually really value going to the nail salon and doing something positive for myself. So that's an indicator. That's an example of a time where I'm feeling guilty and my guilt doesn't fit the facts, right? Like it's not, and I'm using a nail example just to help us compare it to maybe a food example. But that's a really good example of how somebody can experience an emotion that makes them feel really icky, and maybe it shouldn't, right? It's like not totally, it's not justified. Other times, now let's look at a time where I do feel guilty and it does fit the facts. Let's say I lie to my friend and I feel really crummy about it afterwards. My guilt is really starting to rise and I'm starting to feel really awful. I can ask myself, well, did lying violate a moral code of mine? And it's like, yeah, I really value honesty. I need to problem solve this to get my guilt to go down. So I'm gonna go to my friend and apologize and problem solve that situation. So that's what I mean by the emotion regulation skill. Really is going to help you assess, like if you are feeling a negative emotion, to assess the emotion first, check the facts on the emotion, and then based on who you are as a person and your value system and your behavior, deciding if this needs to be problem solved or if it's not. I just kind of need to reset my emotional thermometer because it's saying I should feel guilty when I'm not. This comes up with food.
Sorry. Yeah, I was just going to say, I can see how this comes up with food because we hear people talk all the time. I feel guilty. It was too much. Or I shouldn't have eaten that. And so really asking yourself if you've really violated some kind of moral code by eating that. And then it really does put things into more perspective.
It does. It does. I mean, fear lets us know that our life is in danger. So even if you're continuing to eat right now and you're afraid to finish your plate, and your treatment plan says you need to complete or eat a certain dosage of food a day, because we do think of food as medicine with eating disorders, really asking yourself, is me completing this meal going to endanger me? In fact, it's the opposite. Eating that meal is going to save you, right? It's going to nourish you. It's going to fuel you. Like, so act opposite. So your fear is telling you avoid, don't eat it, but your fire alarm's going off and there's no fire in the building. It's not justified that you're feeling that way. So being able to say that to yourself and then, no, I need to act opposite. My fear is going off, but I got to turn that alarm off and act opposite so that my fire alarm can learn, it doesn't need to go off every time I eat. So every time you turn off that fire alarm and you act opposite, you're shaping the fire alarm to not go off so frequently. It's almost like our fire alarm is like a little bit too sensitive with food. And this one, so that I like to give examples for both, maybe people who are suffering from restriction and people who are on the other side suffering from overeating, is I often, some of my clients, sometimes in a larger body, will feel really nervous about going to buffets or maybe eating dessert in front of people. And they'll often discuss feeling high levels of shame for being somebody in a larger body deciding to eat a piece of cake. And really, it's asking yourself, all those people there, like the people that you're with, if you are really close to them and they're your loved ones, are they going to reject you? Because shame lets us know that if we engage in a behavior, people will kick us out of their group. So asking yourself, if I eat this cake, will my family kick me out of the family? Probably not. So my shame is going off, right? I'm really embarrassed to like eat this food, but there's no fire going off, right? That's our eating disorder, is like really telling us fake news that's not happening. So what I would ask you to do there, to turn off the alarm, in the example I gave before, opposite action would be completing your meal. For somebody who is deciding to eat dessert and they feel shame about it and their shame is not justified, to turn off that fire alarm, tell everybody at the table, hey guys, I'm going to go for seconds. Man, this cake is so great. Act opposite to your shame. Shame is like bacteria, it thrives in the dark. So for eating in secrecy, our shame increases. Well, don't eat in secret. Maybe purposely eat dessert like with people, right? So that you can turn that fire alarm off. And while you're eating the dessert, tell your loved ones you love it, that it tastes really great. And I think that again is another way to act opposite to unjustified feelings of shame that might come up with eating.
That's amazing. And so, yeah, so the opposite action you had referenced before as an intention that often people kind of go into a meal saying, I really know that I need to use my opposite action skill, because that individual may be hearing that alarm and knows that they're really trying to diffuse that alarm and do it anyway.
And I think also with emotion regulation is, there also, if you do engage in DBT, you're also going to learn that so much of what we can do is reducing our vulnerabilities, because we are maybe somebody who does experience emotions more intensely than other people. So the power of changing your environment to support you for success. So whether that's having a meal plan, having all the groceries in your apartment so that you can complete all of your meals, and not being able to engage in avoidant behavior by saying like, oh, it's the coronavirus, so I'm not going to go to the grocery store, and it's totally okay that I'm not following my meal plan because there's a pandemic. Like, we would say no, act opposite to that by reducing your vulnerabilities, making sure you have all the food in already so that it doesn't make it tempting to collude with restricting. So acting opposite in that way and reducing your vulnerabilities. This leads to the second, I think, the second module on the change side of the dialectic, which is interpersonal effectiveness. So I think that one common challenge that we often see in people suffering with eating disorders is their ability to ask for help, ask for a favor, or say no to unwanted requests. I think one trait that we kind of just commonly see is this like people pleasing. It just can be really hard to ask people for support or say no to people. And interpersonal effectiveness, in this module, what clients will learn is how to get their needs met without alienating another person and increasing their self-respect. So it's you asking people for help so effectively, they want to help you and like you more for it, because you came across like such a respected person. And the person's like, wow, like I want to help you because I respect you so much for that. And I think that this can be helpful with, if you are somebody that maybe grocery shopping is really overwhelming because you're somebody who's more on the avoidant side of food. Maybe it's in the beginning asking somebody to go food shopping with you, or asking somebody, can you help me make a grocery list so that I can go in there, get my food and get out? And just kind of asking for help, because it can be so hard for our clients to do that. On the other hand, if you're somebody who's in the beginning of treatment and you're trying to avoid overeating, or you're trying to decrease your binges, your therapist can really help you use these skills to talk to your family members about, hey, while I'm in the beginning of treatment, can you not buy the foods that are triggering for me? Knowing that one day I want to get to a place where I can have all those foods in the house and I'll feel in control. But because I'm in the beginning of treatment, it would set me up more for success if you didn't buy these foods. So learning a whole bunch of acronyms and skills for the person to get their needs met in a way that's really effective for them.
I mean, these are such important life skills. So I was just thinking about how whether or not you have a mental health condition that's been diagnosed, these skills, these strategies are so potent and so helpful just for life. Just, because every person has emotion. Every person struggles with shame, guilt. Many people have a hard time asking for help. Many people have a hard time saying no. So, these are really like life skills.
Absolutely. I'm a DBT therapist and I use the DBT skills on a regular basis. I mean, really, they're just absolutely wonderful, and they make you feel like they make you feel so confident. And the more you use them and the better you get at them, then the more you want to keep using the DBT skills. It's really remarkable, the impact it has on you.
And the other thing I'm just thinking as I hear you talking about is, I think sometimes people think of therapy as being this really open process and you're just kind of talking about whatever comes into your mind, and there's really kind of no like clear focus to it. But this is a very focused treatment. I mean, the way that we set up DBT is that we're really clear. We create a whole hierarchy of the targets of the treatment. What are the things that the client really wants to be working on, and let's put them in order so that we can really systematically address each and every one. And for each and every struggle that person is having, there are ways to problem solve it. There are skills to use to help get through it. So it really is, a very reassuring treatment. Early on, there's a lot of focus on making the commitment to it and understanding why it's going to be helpful, and then really committing yourself. But I think once people get into it and begin to see how effective it can be, it's really such a growth opportunity.
Yeah, it feels very grounding. I think, which it's just very grounding for both the client and the clinician. Like I feel as a DBT provider, I feel a sense of ease knowing that if really difficult topics come up, I have language, I have a protocol to fall back on. So for me, being a little bit of a perfectionist myself, it's actually really wonderful for me also, and for the client. Everybody knows what to expect when they come into their session. We create an agenda. There's also a lot of tracking in DBT. So a lot of tracking of your emotions, a lot of tracking of, if you are doing DBT for eating disorders, what you're eating, behaviors around the eating, because we feel that tracking data is key. And we also know that tracking in and of itself can elicit positive change. So even if you just start DBT and then you decide to not do it, but the one thing you continue is using the DBT tracking devices that we give you, or the diary cards, that in and of itself can help you get better. Simply just knowing that you are becoming more aware of your food choices or aware of your emotions and how you regulate them.
Thank you so much, Liz. You're so full of information, and I love the way you present the information. So it's so helpful. I'm kind of impressed also that I think you kind of tried to eat your food while you were talking.
I did pretty good.
I was able to finish my meal, and I apologize to everybody because I think I lost track of time a little bit. You can see my meal is finished. I lost track of time a little bit, so I don't think I gave the 5-minute call. But I noticed that I probably finished my meal, I think probably in about 15 to 20 minutes, which is not uncommon for me. I'd say that's kind of my common time frame to be able to eat most any meal. And I'm noticing I enjoyed my meal. I'm noticing I'm not stuffed at all. I'm kind of comfortably full, but also thinking about a cookie or something sweet that I'm going to get now for an afternoon snack, because I'm definitely sort of left wanting more. So again, when we go back to doing a therapeutic meal in a treatment setting, oftentimes we come in the end and we really kind of reflect on the experience of the meal, how we're feeling in our bodies afterwards, what thoughts we're having. And then we usually use skills. We talk about what are the skills we're going to use in order to move on from this meal, because oftentimes shame, guilt, come up. Many people describe just feeling that there's a chatter in the mind, thinking about the past, planning for the future. What did I just eat? What am I going to eat later? And so it's really an opportunity where we might be feeling more activated after eating. It's really an important opportunity to think about skills. So maybe if anybody is going to take anything from this talk, maybe there are a couple of skills right now that you learned today that might be helpful. So yeah, sorry, go ahead.
Maybe I can even teach one skill right now.
Yeah, great.
I think that if clients who are following along that are watching us, if it's okay for me to do a little bit of mind reading right now, one during all the meal supports that I've done, one symptom that often clients will report afterwards is an urge to undo the meal or undo their efforts, whether it's they just completed their meal and now they're feeling really uncomfortable, they're really uncomfortably full, their thoughts are firing around, that they might gain weight or all these catastrophic thinking. If somebody's thinking about, maybe I can walk home the long way right now, to undo some of the meal. I think that the biggest thing to do, and this falls under the emotion regulation module, is the cope ahead plan. So I think like right now, before you pack up your meal or you put your plate away, I want you to imagine yourself coping really well with the fact that you just finished this meal. And even if you are somebody who is thinking maybe about 10 cookies they want to eat right now, maybe they're on the other side, imagine yourself going and getting one serving of cookies, whether that's 1 or 2 cookies, whatever the serving says. Just imagine yourself before you get up and leave, coping really well, which would mean not giving into those urges to compensate, not giving into those urges to continue eating if you do feel satiated, because the research shows us that if you can imagine yourself coping well, the chances of you coping well increases significantly. I think like almost all professional athletes use these skills at all time. In fact, Michael Phelps said this is what helped him win that last medal, because he imagined coping well under the worst case scenario. And then his worst case scenario happened. And he said he imagined coping so well, so often that he just kind of went into like a robotic mode. His goggles filled with water. So again, like this is a skill that all people use. So I want you to imagine yourself walking away feeling really great about the fact that you just completed your meal plan and feeling awesome about it. Imagine that, even if it's totally not what you're experiencing in your body right now. Imagine you being really proud of yourself. Imagine you telling your therapist you followed your meal plan today and your therapist positively reinforcing you, or imagine yourself resisting the urge to go back and keep eating. And if you can just close your eyes and really imagine using all of your senses, the ability of you doing that will increase significantly.
Liz Byrnes, that was so great. Thank you so much. It was so nice to see you on the West Coast, and
Yes.
so appreciate your knowledge and sharing all of it with us. And I hope that you'll come back.
Yes, stay safe in New York.
You just brushed the surface, but you really, told us all about DBT. You went through 4 modules. You taught us a bunch of skills. This was definitely an action-packed episode. So thank you very much. And everybody, I hope you have a wonderful afternoon.
Stay safe. Okay.
Stay safe and well. Bye-bye.